Good afternoon. Thank you very much for tuning in today. I'm joined, as you can see, by the Chief Medical Officer who will help me with questions in a few moments. The purpose of today's briefing is to report progress on a number of matters, but also to advise you of a change, I hope a positive change, to the planned easing of lockdown restrictions in relation to travel and to outdoor meetings, and I'll come back to that later. Firstly, though, I will give you today's statistics. The total number of positive cases that were reported yesterday was 221. That's 1.6% of the total number of tests carried out and takes the overall number of confirmed cases now to 222,382. 133 people are currently in hospital, that's 21 fewer than yesterday, and 20 people are receiving intensive care, which is a reduction of 1 from yesterday. Unfortunately, 3 further deaths were reported yesterday, and that takes the total number of deaths registered under this daily measurement to 7,633. And once again today, I want to send my condolences to everyone who has lost a loved one. Let me also give a quick update on the latest vaccination figures. As of 7:30 this morning, 2,682,706 people have received the first dose of the vaccine, and that is an increase of 13,983 since yesterday. In addition to that, 14,952 people received a second dose yesterday, and that brings the total number of second doses administered now to 605,126. So where we are now is that virtually all over 60-year-olds have received at least the first dose of the vaccine, and so too have 96% of 55 to 59-year-olds and 84% of 50 to 54-year-olds. Overall, we've given a first dose now to almost 60% of the whole adult population, and we have now effectively met our target of offering a first dose by the middle of this month to everyone over 50, all unpaid carers and all adults with particular underlying health conditions. And significantly, these groups account for 99% of all COVID-related deaths, so that is quite a significant milestone. We've also made significant progress in reducing the number of new COVID cases that we're seeing now reported in Scotland. That, of course, is partly due to the success of the vaccination programme, but it is also, and we shouldn't lose sight of this, because so many people have stuck so well to all of the really difficult rules over the last months. To put the reduction we're seeing now into some context, back in the early part of January, we were recording more than 2,000 new cases on average every single day in Scotland. We're now recording fewer than 300 a day. And the figures that we are seeing now represent the lowest level since late September last year. In fact, we've seen a decline of more than 85% since early January and a fall of well over 40% just in the past 2 weeks. We're also seeing the number of people in hospital and intensive care continue to reduce, and thankfully the number of deaths has fallen sharply as well. So all of that is really good progress. That said, and you would expect me to say this, we do still need to be cautious. We can see why we still need to be cautious by looking quickly around many other countries across Europe and the world. But here in Scotland, for the past few weeks, and this was a concern for a period, we've had rates of infection here in Scotland that were a bit higher than in some other parts of the UK, though, as I've just said, we are now starting to see case numbers falling more markedly and more consistently. But that is one reason to be cautious. But we've also seen over the past week or so some easing of restrictions. So last week we saw the reopening of hairdressers and some retail outlets. And of course, over this week and next week, there is going to be already a much more significant change as all secondary schools return full time. So we've got to be careful, and this has always been the way with this virus, not to do too much all at once, because we don't want the virus quickly gaining ground again, particularly since this new variant is, we know, more infectious, and then setting us all back. All of that said, because the data in the last 2 weeks in particular has been so encouraging, we are now in a position to give a bit more certainty to individuals and businesses about the way ahead, and indeed accelerate one aspect of the exit from lockdown, which I think is important for our personal well-being. First of all, while of course we will continue to monitor the data, we are now extremely confident that those parts of the country currently in level 4 will move to level 3 on the 26th of April. That's now less than 2 weeks away. That means, amongst other things, that on that date shops will fully reopen, pubs, cafes and restaurants will also be able to fully open outdoors on the 26th of April, and indeed they'll be able to open indoors on that day, albeit on a restricted basis. And it's worth noting, I think, that the restricted indoor opening of hospitality on the 26th will be actually 3 weeks ahead of any indoor opening of hospitality in England. Let me say a word now, though, about our island communities. Several of our islands, including Shetland, Orkney and the Western Isles, are already in level 3. That partly reflects the fact that they have had lower rates of COVID than the mainland, although there have been outbreaks, which again shows the need for caution even in our remoter communities and on our islands. Now, I set out previously that we would consult with island communities about whether from the 26th of April they wanted to move down to level 2, which the data would justify, even although that would necessitate keeping travel restrictions to and from the mainland in place to avoid the risk of cases being imported to and spreading within the islands. Or alternatively, whether they preferred to stay at level 3 with the rest of the country for a further 3 weeks to enable the lifting of travel restrictions and the opening of tourism and hospitality to visitors. Now, I think it's fair to say there's no universal opinion here, so I know that neither option will please everybody. However, based on the balance of opinion, we have decided on the latter option, aligning islands with the rest of the country for a period so that travel and therefore parts of the economy that so many islanders rely on can operate more normally from the 26th of April. Now, to those who would have preferred to see the islands move to level 2 at the end of April, I think it's important to reassure you that we do expect, very firmly expect, to see a move to at least level 3 for the islands 3 weeks after that, so from the 17th of May. So it's not a long, or in the context of what we've been dealing with over the past year, every day I know feels like an eternity, but it's not an unending period of time. In the meantime, though, as a result of staying in level 3 for a bit longer, it will be possible for islanders and visitors to travel to and from the islands, and I know that will make a difference to many individuals and businesses on our islands. Now, more generally, we expect the whole country to move to at least level 2 on the 17th of May, then to level 1 in early June and to level 0 in later June. Updated levels tables are also being published on the Scottish Government's website later today, and that will help you see exactly what these changes will mean in practice. But amongst other things, amongst many other things, it means that we should be able to meet up in each other's homes, indoors in each other's homes, albeit in small groups, from the middle of May onwards, and that is something I know everybody is really looking forward to. Now, I mentioned that we expect to reach level 0 at the latter part of June. However, I'm well aware that level 0, although a vast improvement on where we are now, still involves some significant restrictions in some respects. So I want to be clear again, as I was earlier when we set out the revised route map, that reaching level 3 is not the full extent of our ambitions. Later on in the summer, as the number of people who've been vaccinated increases further, we do hope that a level of normality well beyond level 0 will become possible. I know that many people want to see venues like nightclubs open again, and all of us want to be able to have bigger groups of people round to our houses. And almost all of us, if not absolutely all of us, are desperate to be able to hug our loved ones again. I remain optimistic. In fact, I'm more optimistic now than I was even a few weeks ago that some or hopefully all of that will be possible in the months ahead and over the summer period. Lastly, though, today I want to set out, as I indicated earlier on, a change to our existing plans. Now, we've always said we will keep plans under review and accelerate the lifting of restrictions if that ever becomes possible. Indeed, we are actually legally obliged not to keep restrictions in place for longer than they are needed. Now, it's important to stress that the improved data, and I'm sure the Chief Medical Officer will underline this point later, the improved data does not allow us simply to throw caution to the wind, certainly not if we want to be sensible about this, but it does give us a bit of limited headroom. So we've considered whether we can bring forward any changes that will particularly boost mental health and well-being. So we focus really on trying as far as possible to give families more opportunity to get together earlier than was planned. So in particular, we've looked at travel within Scotland to see friends and family, albeit outdoors. At the moment, we can't leave our own local authority areas except for an essential purpose, and that rule was due to remain in place until the 26th of April. But the data allows us to make a change to this earlier than that. So from Friday, that's Friday this week, the 16th of April, we will all be able to travel anywhere within Scotland for the purposes of outdoor socialising, recreation or informal exercise. And we are also able to relax the rules for meeting people outdoors again from Friday this week. At the moment, a maximum of 4 adults from 2 households are permitted to meet outdoors. From Friday onwards, that will change to 6 adults from up to 6 households. So that's quite a significant relaxation of that outdoor meeting limit. So in summary, from the end of this week, you'll be able to meet up with family and friends who live in different parts of the country. I know many of those reunions will be long awaited and much anticipated. But please do remember that at this stage, probably until the middle of May, meetings must still be outdoors, not inside our own homes. And I would ask everybody to please be careful and remember that due to physical distancing, public transport capacity remains relatively limited. And remember also that travel restrictions for wider purposes such as leisure, shopping, visiting hospitality premises or staying in tourist accommodation will remain until the 26th of April, when these places reopen and all travel restrictions within Scotland will be lifted. I also want to confirm today that we do expect to lift travel restrictions to and from England and Wales on the 26th of April, something that I know will be welcomed by many and perhaps in particular businesses in our tourism sector. Now, it might still be necessary in future to have temporary travel restrictions to and from places with high rates of COVID. We will be very serious about mitigating any risk of importing the virus and particularly new variants of the virus into Scotland. So we may see some limited travel restrictions in future, either within Scotland or between Scotland and other parts of the UK. But from the 26th of April, we intend that people in Scotland will be able to travel anywhere across Britain. Northern Ireland is due to review its restrictions later this week, so we will review our approach to travel there before the 26th of April, and we hope that that can be freed up too. And travel restrictions to and from other parts of the Common Travel Area, including the Republic of Ireland, the Isle of Man and the Channel Islands, will also be kept under review. We also hope to be able to agree rules for international travel on a foreign nations basis. I should stress, however, and I know this is difficult, but it's important for me to stress it, that international travel does remain a significant risk, particularly given the acceleration of spread that we're seeing in many other parts of the world, and given the possibility and indeed the reality of new variants and the risk of the virus and new variants of the virus being imported into Scotland. So it may well be the case that we do have to endure restrictions on international travel for a bit longer, as the price we pay for much greater normality here in Scotland. I know that's not easy, and often when we talk about international travel, we talk about holidays, but I'm very well aware that for many people, international travel is about seeing families. So we will not keep these restrictions in place for longer than necessary, but it is important right now to protect our progress here, that we don't make the mistakes that we perhaps made as we came out of lockdown last time and open up international travel too quickly and then compromise and jeopardise the progress that we have made. However, back to the positive, from Friday we will be able to travel more freely within Scotland and to meet up in larger groups outside. A week later, on 26 April, the retail and the hospitality sectors will reopen, and then as the summer progresses, we do expect to see a return to much greater normality. All of that is positive news, I hope. It's a testament to the success of the vaccination programme, but actually more than that, it is down to the sacrifices that everybody has made up until now. I know how tough that has been. I know how tough it still is, but it is those sacrifices that is now making possible the easing of restrictions that lie ahead of us. But the final point I need to make really relates to that one. It is the truth and the continuing reality that the best way to keep on making progress out of lockdown is to continue to keep cases low. COVID is in retreat in Scotland, there's no doubt about that, but it hasn't gone away. It won't simply magically go away. It will come back if we allow it to come back. So we must still exercise care and caution because we want our progress this time, even if it is not as fast as we all want it to be firmly in one direction. So that means continuing to stick to the rules that are in place. In particular for now, please don't meet other households in your home or in their homes. We hope that can be eased from the middle of May. Continue to work from home if you can for now, and on any occasion when you are out and about, and this actually becomes more important as we start to ease restrictions, remember all of the basic rules. Wear your face covering, avoid places that are busy. So this weekend, if you decide to travel a bit further to see a group of friends or family, if you go to somewhere that's crowded, come away and go somewhere else. Remember to clean your hands regularly, use 2-metre distancing and self-isolate and get a test if you have symptoms. And as I said, these precautions become more important as we open up. One final point I just want to clarify, which I should have said earlier on, the move to 6 people from 6 households outdoors, of course, doesn't include children under 12. They don't count to that limit. If we all continue to do the right things, do the sensible things, enjoy responsibly these easing of restrictions, then there's every reason for us now to be really optimistic that we're on the right track, firmly on the right track. So let me end by thanking you again for everything you've done to make all of that possible. We'll move now to questions, and Gregor will help me with the questions. And first today, I'll go to Glenn Campbell from the BBC.
Thank you, First Minister. If you're able to ease some restrictions faster, does that mean that the overall timetable for getting out of lockdown might be speeded up? And how big a consideration in your decision-making is the Holyrood election timetable?
It's not a consideration at all, and I should have said I will not answer questions about the election here because we are in an election period, so anything about the election I will answer straight away. But it's not a consideration at all. If I was acting on an election timetable, I'd probably be opening up a lot more quickly than I am just now. So anybody who thinks that hasn't been paying attention to what we've been doing carefully and cautiously over the past number of months. In terms of your substantive question, though, we are under a legal obligation to keep all of this under review. We are under a legal obligation, as you would expect, because these restrictions are very constraining of people's individual liberty. So we're under a legal obligation not to keep restrictions in place any longer than is necessary. So we will always look to accelerate where we can, but we have to balance that with the care and caution that avoids us going backwards. So I've said today that we are on track for the very significant reopening of the economy on the 26th. The further changes come mid-May, then early June and late June. And at the moment, particularly given the need to have a period of time to assess changes before we make other big substantial changes, that is the timetable that I would expect us broadly to follow. But we keep it under review, and if there are any aspects within any of these broad packages of change, as we're doing today, that we can bring forward, then we will do that, because we want to get back to normal as quickly as possible. But the way to achieve that is for all of us to continue within the rules that remain in place to apply that downward pressure on the virus, and of course, and this is the responsibility for government, the NHS and our vaccinators, to continue that excellent progress we've seen with vaccination so far. Ross Govins from STV.
Afternoon, First Minister. With the easing of the restrictions you've announced there, are you slightly concerned that we're going to see people who are desperate to get out? They're going to be out this weekend, possibly beauty spots, beaches, etc. But none of the infrastructure to help cope with that will be open. And doesn't that fit into the hospitality sector, who's saying, shouldn't at least outdoor hospitality in Scotland be in line with south of the border, and that would help to cope with possibly these large numbers?
Look, there's no absolute right and wrong way of doing this. I've tried to say that all along. We have to strike the right balance. We simply cannot do everything all at once. And there are greater risks. Even so, outdoors, the risks of transmission are lower than they are indoors. But, you know, where you have alcohol in hospitality, they're a bit higher than they are with people just coming together in a park or on a beach. So we've got to balance all of that. I've all along, and sometimes people have agreed with the decisions we've reached, sometimes they won't. I've tried to do this at the pace that is right for Scotland. There will always be comparisons made here. We come out of lockdown about 2 weeks generally. There were variations in this last time, about 2 weeks behind England, and we actually stayed out of lockdown longer as a result of that. And England, I think you could argue England being in its third national lockdown compared to our second. So we've taken a cautious approach that is right for us. The opening of hospitality on the 26th will be outdoors pretty much as normal with physical distancing and such like. But we will also, on the 26th, have limited indoor opening of hospitality. That's not scheduled in England until middle of May. So there are swings and roundabouts here, and we have to try to do it at a pace and on a phasing that is right for Scotland. On the first part of your question, obviously we're talking to national parks and such like. I would continue to really encourage people not to crowd into places because that is always a risk. But whenever we open up, because there is pent-up desire on the part of all of us to get out and do things we've not been able to do, then that's a risk that we need to try to guard against and advise people against. One reason for not opening everything at the same time, so not doing what you said is just allow hospitality to open outdoors at the same time as we do this, is to try to phase that, so to ease that pressure a bit more gradually, so that by the time we open outdoor hospitality, some people might already have seen their families in their gardens, so there will be less of a sort of one-day crowding together. None of that is absolutely foolproof. None of that is guaranteed to work, but it is about a careful and cautious route forward. We need to do this as carefully as possible, and that's what we will continue to try to do. And it has, by and large, with setbacks as we went into the second wave, the new variant, by and large, that cautious approach has served us quite well in Scotland. We have lower case numbers overall, lower deaths overall, so we need to try and keep that cautious approach as we come out so that we can continue to move in the right direction.
Yeah, we've come an awful long way in the 4 months since the start of the year. When you look at the infection case rate just now, about 37 cases per 100,000 population, 7-day cumulative incidence in Scotland at this moment in time. That's a huge difference compared to where we were at the start of the year. And even in the last 7 days, we've seen another step change. We were plateauing with our figures for probably a period of about 3 weeks now. But then we've seen that deceleration and reduction in figures over those last 7 days as well. This is all really encouraging, but it would be a real mistake to think that this is over just now. WHO held a press conference last night, and their leaders spoke about the need for people to guard against complacency just now. And I would echo that just now, because the infection is still out there. We're still reporting today 221 new cases of the virus. We still know that around 1 in 410 people in Scotland have this virus just now. So the possibility of getting infection is still there just now. And if we let our guard down, and if we're not careful, and if we become complacent about the distancing or wearing masks or any of the other measures that we've taken over these last 12 months, those infection rates will begin to rise again. Make no doubt about it at all. And there are still enough people in this country who are unvaccinated in age groups who will end up in hospital with severe illness and dying if we are not careful. There is lots that we should take encouragement about just now. My plea to everyone is just to make sure that as you're starting to go about your business, as you're starting to see people again, please don't become too complacent. Make sure that you're safeguarding yourself and make sure that you're safeguarding others.
Tim Batchel from ITV Border.
Good afternoon. Could I ask you about the travel timetable that you've announced? People will be delighted, I'm sure, that they can travel anywhere in Scotland from Friday. But can you explain why people won't at that same stage be allowed to travel over the border when, for a lot of people who live close to the border, it can be a very short journey to go to places like Carlisle, Berwick, and so on. And on a related matter, are you worried that with a different hospitality timescale in England and Scotland, that people will be tempted to go over the border from Scotland into England to visit a pub?
I think the vast majority of people want to be responsible, and you know, for the sake of 2 weeks, I think it is very easy to overstate that risk. Does that mean nobody will do it? I wouldn't say that, but I think you can easily overstate that. And remember, while pubs are not yet open in Scotland, they will be less than 2 weeks from now when they do open. They'll be open on a slightly more expansive basis than they are in England for the next 3 weeks. So these are swings and roundabouts. Why are we taking a further 2 weeks to open cross-border travel? Because for that 2 week period, we have that difference in levels of restriction, particularly around hospitality, for example. We don't think it is yet safe for us to open up hospitality because of the school reopening that's underway, because of some of the other changes. So we think we need that extra couple of weeks. So we don't want people travelling across the border, going to pubs and potentially bringing the virus back. So these are just the balanced judgments we have to make. So we, you know, barring unforeseen developments, cross-border travel will open again on the 26th of April, now less than 2 weeks away. I think, you know, you'll always find exceptions to this because this is such a difficult thing everybody's been through, and people's attitudes to it vary, and, you know, people get fed up with it, and we're all fed up with it, but people's tolerance is not all at the same level. But I think the vast majority of people, are responsible about their own health, the health of people they love. But I think the vast majority of people know the progress we've made and don't want to jeopardise it. So I think the vast majority will continue to do what is necessary to get us through these next weeks and into something over the summer that is far, far more normal than what we are living with right now. Phil McDonald from Global.
Thank you, First Minister. People down in England over the age of 45 are now able to book their vaccine appointments. I'm just looking for an update when people of the same age will be able to get or be invited to get a jab here.
That will be underway over the next few days. We've met the target for the all of April of all 1 to 9 JCVI priority groups. That's everybody over 50 being offered the vaccine, all unpaid carers, people with underlying health conditions. That's the bulk of the adult population. 99% of all COVID deaths come from these groups. So we've effectively met that target of offering everybody the vaccine. Some people will still be taking it up. I'm in that one of those categories. I get my vaccine later this week, so I've been offered it, but it's a couple of days before I actually get it. And then health boards will start to issue appointments for the next age cohort shortly after that. So people in that 45 to 50 age group will be the next age cohort in line.
I'm just looking forward to that next age group opening up and waiting in my turn in the queue.
That's Gregor's polite way of reminding me that he is younger than me, although, let me say, not by very much. Ali McGilvray from Bauer Radio. I don't think we've got Ali just now, so I'll go to Nicole Cassells from Central.
Thank you, First Minister. So looking at the latest data, Clackmannanshire still has the highest infection rate in Scotland, which appears to be a lot higher than the rest of the country. So how concerned are you about this area as we get set to ease more restrictions?
So Gregor wants to say a word about this. Clackmannanshire is the area in Scotland right now. These things will vary from time to time, but right now is the area with the highest numbers of cases proportionately. We have been looking carefully at that. There have been some particular reasons, and we think it is, you know, starting to hopefully come down, but we'll be monitoring that carefully. But I'll ask Gregor to say a bit more.
Yeah, I mean, Clackmannanshire has clearly been a focus of attention over the last couple of weeks. We've been watching the case rate in that area just now. It's reduced substantially during that time from a peak of over 200 cases per 100,000 7-day cumulative incidents to now just over 100. So we're seeing that reduction even in that area. It's the only local authority in Scotland just now that remains over that level. One of the features of Clackmannanshire, of course, that we need to bear in mind is that it only takes a very small number of infections to cause quite marked fluctuations within that 7-day case rate because of the size of the population there. So that needs factored in as well. Plus, We've got a very capable Director of Public Health who works in that area, who is very proactive in the way that he is looking for cases in the asymptomatic testing programme and finding cases, managing those outbreaks. So this is a well understood area of infection just now. And as I say, I'm very encouraged by the progress that they've made in recent days.
Neil Pooran from PA.
Thanks, First Minister. In terms of the changes you've announced today about outdoor meetings, what does the modelling tell you about how this will impact on both case numbers and the numbers of contacts people are having from day to day? Is there a danger that if still a lot of the population not yet had the vaccine, there'll be that rapid rise in cases among the unvaccinated population?
So I'll ask Gregor to say a word about this. Let me just be very clear, as I think I have been all along. Whenever we ease restrictions and people start to come together again in greater numbers, there is a risk and probably a reality that you will see some increase in cases. The challenge is to keep all of the other mitigations sufficiently in place to make that as minimal an increase in cases as possible. And the vaccine progressively, hopefully, has a suppressive effect on transmission as well, although its bigger effect is on stopping people getting ill and dying. But this is an infectious virus. The only way really to stop it spreading from one person to another is for all of us just to stay far enough apart forever. We can't do that. So anytime we ease restrictions, that risk increases. What Gregor advises me, and he can speak for himself, obviously, is that the risk is lowest when we're talking about outdoor gatherings, and particularly as the weather, and I hesitate to say this in Scotland, but as the weather gets a bit brighter with more sunshine, maybe a bit warmer, we hope that might also have a bit of an effect as well, although I think that is less certain. So the least there's no zero risk things we do in the face of an infectious virus, but the least risky thing we can do is open up outdoor. And that's why we do these things first. It's why we allow more easing outdoors, and particularly when we're looking at people's well-being and mental health, because remember, there's an impact of keeping people apart as well, that we've chosen to focus on outdoor and on family contact first, because I think at this stage in the whole journey, that probably is what people are missing most. But nothing here is risk-free and won't be as long as we're dealing with this virus.
We use this word risk a lot, and it's important that we continually reassess risk as we kind of proceed. Some of that reassessment is about the way that we look at the data for infections and how that translates across to severe illness and hospitalisation. Some of that is about the number of infections that we get at its most basic level just now. And what we're seeing just now is a transition phase. Because of the success of the vaccination programme, we are seeing a decoupling of the infections numbers that we have across the country and the way that they have traditionally translated into severe illness and deaths across the country. That whole assessment of risk is now changing. We also see a gradient of risk across different venues as well, as you know, Neil, and that it's very much there is a reduced risk of transmission when we go about our business outdoors, making sure that we keep our distance from each other and so forth. That risk of transmission outdoors compared to indoors, particularly in poorly ventilated areas indoors, again, is a gradient of risk as well. So all these factors are taken into account when we're starting to make the changes. Now, we'll continue to look at this data very, very carefully, particularly using the EVE2 database that Public Health Scotland run in terms of tracking severe illness across Scotland, and look at the way that those cases that we're seeing on a daily basis translate into hospitalisation or the need for care in ICU. As I say, we're seeing a whole different picture at this point in time than we did in the past. As we vaccinate more and more people in those older age groups, working next in that 40 to 50 age group, again, what we will see is a further reduction in the likelihood and the risk of severe infection across that population as well. Now, we're not out the woods yet. Clearly, we're not out the woods yet. But as long as we continue to track that, we can then calibrate the way that we reopen and allow people to come back together and take part in society with the risk of that severe illness and infection in particular.
Thanks. Right, Chrissy Lavelle from The Sun.
Thank you, First Minister. Last week you said modellers were looking at whether the recommendation not to give the under 30s the AstraZeneca vaccine would affect the end of July target for getting all adults their first dose. I just wondered if there was any update or assurance that you could give around that today. And also on Friday, Jean Freeman admitted that you didn't take the right precautions to make sure older people leaving hospital going into care homes were as safe as they could be. You've always said that the buck stops with you on decisions taken by your government. Do you accept responsibility for this, and will you apologise for the mistake?
I'll come back to that in a second, but I've always taken responsibility and I've always readily apologised for any things that the government got wrong. On the first part of your question, so we continue to assess, literally on a daily basis, projections for supply versus demand. But at the moment, we don't think that decision about AstraZeneca for the under 30s will in any material sense change our ability to meet the end of July target. So just to recap, having met the target to offer the first dose to everybody in the JCVI priority list by the middle of this month, i.e. almost now, it is our expectation that all of the adult population will have been offered a first dose by the end of July, and we still expect to meet that target even with that decision last week about not using AstraZeneca in the under 30s. But I would repeat again something I've said often, our sort of understanding of supply fluctuates, so it is possible that supplies that we are expecting to get in a few weeks' time don't quite materialise on that particular time scale. So we have to keep all of this under review. But at the moment, we are confident that we will be able to meet that target. On care homes, and Jean on Friday was doing what I've always tried to do, not do what politicians sometimes do, is just dig your heels in and say we never get anything wrong. Back in sort of late February into March last year, we were faced with a horrendous situation with horrendous decisions that flowed from that. We were watching pictures on our television of hospitals in Italy being overrun by COVID. And back then, we didn't have the hindsight that we all have now. We were having to take the decisions we thought were best. And we took all of the decisions we took thinking they were the best ones. We thought it was wrong to leave older people in hospitals that were about to be overrun with COVID. We thought they would be safer in other settings with the right infection protection procedures and isolation procedures in place. And we didn't know what we know now about asymptomatic transmission. We have tried to learn as we have gone along, and we've made changes as we've gone along. And thankfully, although one death is one too many, in the second wave that we have experienced, deaths in care homes have been significantly lower than in the first, because we have learned those lessons as we've gone along. So I can't turn the clock back, and I cannot turn the clock back and know everything then that I know now. We tried to take the best decisions, but we would have got things wrong. It's inevitable given what we were dealing with, but that doesn't mean that the sense of responsibility we feel for that is any less. The last point I would make there, and I think we're still the first of the UK governments to give this commitment, is that there will be a full public inquiry into all of this. And I hope that we will see that public inquiry get underway later this year. Elsa Maishman from the Scotsman.
Hello, sorry, thanks, First Minister. Can you hear me?
Mm-hmm.
Thank you. First Minister, I just wanted to ask about the vaccine rollout. The UK government said this morning that, or yesterday evening, that all over 50s have definitely been offered a first dose, and that target's definitely been hit. You're saying it's effectively been hit. Is it the case that Scotland is still a day or two behind, or is it the case that we've definitely hit that target? And I wonder if you can give a bit more clarity on the further guidance as regards the rollout of phase 2. When would we be expecting that? Is there any more information or more detail to come?
We're expecting that to come from the JCVI very soon, so I'll ask Gregor to say what he can about that. I'm using the word effectively just to recognise that in any big system, it's possible that somebody's been missed. Somebody's address might have not been changed on a GP system, or somebody's letter might have gone missing in the post. So I don't want to stand here and say everybody has been offered the vaccine and then somebody, in one of these groups is sitting at home saying, I haven't had mine. And when you're dealing with this big scale of a system, you will always, and we found this at earlier stage, there will be some people that have fallen through the cracks. That's why we've got the helpline, and you should phone your GP or the helpline if you are in that position. So I'm just using the word effectively to recognise that there will not be 100% perfection when you're dealing with something of this scale. But when I say we've effectively met it, is that we think we've offered everybody in these groups the vaccine, but of course not everybody will yet have had the vaccine. And again, I use myself as an example of that. I've had the offer, I've had my blue envelope, but I don't get the vaccine until later this week. And there will still be a number of people in those categories, although in my age cohort, I think the figure I gave today was that 84% have actually had the vaccine. So that will keep up and up and up, and we're unlikely to get to 100% in these cohorts, but we want to get to as close to that as we can.
So my understanding also is that at this moment in time, perhaps even just a slightly earlier than this, JCVI were publishing their updated guidance on their website and holding a news conference just to outline that guidance just now, so we can speak about it. And it's as expected is that they have advised that we continue to follow that age-based cohort from 18 to 49, splitting those three cohorts into 3 ages and proceeding with the next group for vaccination, which will be 40 to 49 from this moment onwards. So the planning is already underway for that. People will start to receive invitations across Scotland very soon in terms of being invited to come and get their vaccines for that. What I want to emphasise again to people is that there are particular characteristics even within those age groups, which means that the risk is such we would encourage you to uptake your vaccine as quickly as possible. So males in particular, for those from BAME communities and also people who are obese in the weight range with a BMI above 30 as well, we would particularly encourage all of those groups to take your vaccine as quickly as possible, because we know that as well as age being the most defining characteristic of risk, these are additional risk groups which we would want to be receiving the protection as quickly as possible.
Just to final point in relation to a comment Gregor made there about BAME communities, and particularly relevant to our Muslim community, which marks Ramadan from tomorrow. Ramadan Mubarak to anyone watching. But of course, and the Muslim community have been making this very clear. Getting the vaccine is not breaking your fast during Ramadan. So you should still come forward for the vaccine during Ramadan if you're invited to do so. Georgina Hayes from the Daily Telegraph.
Good afternoon and thank you. I was just wondering, if England allows foreign travel this summer and Scotland doesn't, which it could be a likely possibility, do you think that there's a risk of travel restrictions being reimposed between Scotland and England? Thank you.
We have to take, so I hope that doesn't happen, because I hope all 4 nations in the UK will be appropriately cautious when it comes to international travel, because it is our biggest risk of undoing all the progress we've made, frankly, not just in having the virus spread again with new variants, but perhaps new variants undermining the vaccines that we've got. We absolutely don't want to risk that. So I hope we won't be in that position. But we will, in Scotland, do everything we can to protect ourselves from that risk. So if there is a significant divergence, and I hope there won't be, we will have to consider what is necessary to deal with that. But let's not cross, if you pardon the pun, when we're talking about travel, let's not cross bridges before we absolutely come to them. Rachel Watson from the Mail.
Thank you, First Minister. I just firstly want to go back to the question from Christine on care homes. You mentioned seeing images of hospitals in Italy, for example. There were also images at that time of care homes in Europe and then the United States being overrun and lots of residents dying from the virus. So when did the government realise that a mistake had been made with this decision? And also, just on your announcement today, you've changed quite significantly to allow 6 people from 6 households to meet, which, if I'm correctly understanding it, was 6 from 3 would have been the next step. And what's behind that change?
What's behind that change is just advice that we can be not completely relaxed or complacent, but a bit more permissive when it comes to outdoor meeting up, because the risks of transmission are lower outdoors, hopefully particularly as the weather gets a bit brighter and there's more UV rays there to help with this. So that is what's behind it, and we want to give people as much ability to come together as we can, and for as long as we have to continue to be quite restrictive indoors, if we can open up more outdoors to compensate for that in any way, then we'll do that. Well, I'll be corrected if I'm wrong here. I'm not sure you're strictly correct in terms of what we were seeing on our televisions at exactly the same time. Equally, I wish with everything I've got that these decisions back then had been clearer cut and simpler and easier, and we could all foresee exactly what was going to happen, because, rightly people hold politicians like me and leaders like me to account for this, but please believe me when I say I carry the weight of this every single day and always will in terms of the decisions that we were taking. And I think you can oversimplify to say, when did you realise you'd made a mistake? We learned more about the virus and we adapted what we did in light of that, as we were, I think, right to do. I wish I could turn the clock back, know everything then that we know now, and make different decisions at the outset, but I can't do that. And I've always tried to be open about that. I always will try to be open about that, and I will be absolutely, as long as I'm responsible for these decisions, I will be absolutely determined to make sure there's full scrutiny and accountability through the public inquiry that I've already spoken about. Helen McCardle from the Herald. Oh, Helen McCardle is not joining us, so the last question today is Mark McLaughlin from the Times.
Good afternoon, First Minister. Can I talk about exams by another name again? Now, last week you said there's no requirement to replicate a full exam or prelim this year, and that we trust teacher judgment. Excuse me. But the SQA papers are very prescriptive. They say that it should be done on maths, for example. They're providing question papers which should be filled out confidentially. In biology, it should be done under closed book conditions, and the teachers should give greater weight to the evidence that most closely mirrors the SQA question paper. So it does seem like there is a lot of kind of prescription coming down from central government to the teachers, which doesn't quite tally with what you were saying last week about teacher judgment and autonomy. The SSTA says the SQA tail is wagging the education system dog.
Look, I don't think it doesn't tally. The guidance that you talk about, and there's subject by subject guidance, was actually the approach that's been taken. Remember, we have to have a system in place that takes account of the fact we don't have exams this year. Teacher judgment is at the heart of that. They have a requirement to evidence to some extent their judgment, and there will be different ways of doing that, subject to subject, depending on the nature of the subject, and also teacher judgment. But the approach to that was designed in consultation with the teaching profession, with the teaching unions, and the SQA will continue to engage as appropriate around that. So I appreciate that no matter how we try to do these things, to take account of the fact that exams can't be held, there will be concerns and anxieties and difficulties. I really do appreciate that. But we are trying and the SQA have done that in consultation with teachers to put in place the best system that is possible. But I understand how difficult all of this continues to be for young people across the country. I'm being told Helen McCardle has rejoined us. So, Helen.
Hello, afternoon. Sorry, I think my internet cut out just at the wrong time. I was just wondering, I was having a look at the State of the Epidemic report from last Friday, and it had mentioned that as of April the 7th, we had 23 confirmed cases of the South African variant in Scotland and 5 probable. There was also 4 confirmed and 1 probable of the Brazilian variant. So I just wondered if we could get an update in terms of whereabouts in Scotland these variants have been detected, and is it still the case that they're all directly linked with travel? Thanks.
I'm not sure we'll be able to give you all the locations of them, but I'll hand over to Gregor to give a bit more, and particularly around our assurance about their travel links.
So at this moment, Helen, we've got the last data that I saw earlier today showed that we had 25 cases of B1351, sometimes referred to as the South African variant, and 6 confirmed cases of P1, sometimes associated with Manaus in Brazil. I wouldn't want to comment on the locations of those because of the possibility of deductive disclosure of some of those cases at all. But what I can say to you is that there's no evidence of any community transmission that's related to those cases, and that we continue to keep a very close eye on them. We're now at the point in time where, with the capacity that we have for genomic sequencing within Scotland and the number of cases that we're seeing on a daily basis, that we can sequence virtually all cases across Scotland now. And that's a huge step forward in terms of the way that we're able to track the possibility of new variants arising across Scotland. It's something which is almost unique in countries across the world, in that we've got so much capacity for genomic sequencing as well. And that will serve us well for the future, both in terms of how we track COVID infection across Scotland here and in the immediate future, but also how we look at other infectious pathogens and the way that they track across Scotland as well at points in time in the future as well. So at this moment in time, there has been a slight increase in the number of cases from the number of these variants of concern that you've said, but it's very small. It's contained, and there's no evidence of community transmission beyond that.
Okay, thanks very much. That concludes the questions for today. So my thanks to the journalists for joining us, and to Gregor, obviously, for helping me answer the questions, to Rachel for our interpretation, and to you for tuning in. Just to very briefly summarise, we're on track for the reopening in line with the route map, starting with, schools are going back over this week and next week. Some services reopened last week, but the significant next phase is the 26th of April, when shops will open and hospitality will substantially reopen as well. But before that, from this Friday, you can travel within Scotland for social gatherings, for socialising outdoors, for recreation, for exercise, and you can see up to 6 people from 6 households outdoors, which hopefully will be good and positive news for people desperate to see friends and family. So please enjoy the slight easing of restrictions from Friday, but please continue to be careful and be cautious in how you go about things, because it is all of that that is getting us to the position we're in just now. So we want to make sure we keep moving forward. I am likely to do a briefing next Tuesday just to finally confirm the changes that will take place on the 26th of April. And in the meantime, as I said earlier on, the revised levels tables will be published on the Scottish Government's website later today, which will let you see what is possible at each of the levels that we will move through over the next few weeks. But for now, thank you very much for joining us. Please continue to look after yourself, look after each other, and stay safe.